Yeah, so Tom, there's going to be lots of improvements to this unit with the above and beyond appeal. So at the moment this is a 17-bedded inpatient unit. One of the things that's going to be great for us is we're going to go over to having more side rooms so that patients can be isolated. Again, we've got lots of private areas that we can take patients and talk to them, because I'm sure, as you can imagine, if you come into the day unit and you need to see the doctor, at the moment you're talking about all those things in front of all the other patients that are in there.
Yes.
So the other thing that I think is really important about our new unit, and obviously what above and beyond are going to help us to achieve, is that I feel as a nurse we give excellent quality care.
Yes.
And I think our environment doesn't show that. We also know that in our new build that we're going to have a new place that patients can go, so we've got a discharge area. And we're going to have an area, at the moment we've got a quiet room, but it's used all the time. So again, we're having lots more areas where people can go off, patients can go off with their family and sit down and just have a bit of time with them. And equally, just other areas that you can go rather than just feeling like you're stuck in your room as you are at the moment. Hi Steffi, as you know, you helped out with some of the work that was happening with the above and beyond in the outpatients and the reception area downstairs. And what's happening now is the above and beyond are helping us with our appeal up here on the haematology unit. So as you know currently, from your experience, we have patients that currently will be treated in the transplant unit over at the Children's Hospital. They'll be treated here in the Oncology Centre, and they'll also be treated at the apheresis unit in Southmead. So what's happening with our new unit and this appeal that we've got with the above and beyond is about bringing all those three services into one place.
So the existing unit, which is a combined paediatric and adult unit, was really mainly designed with children in mind, and so it has the decorations of a paediatric ward, it has benches at the height that children would like them at, and so one of the big advantages here is that we're going to move the adults to an adult appropriate environment.
So at the moment, usually the diagnosis is made within this building in the Avon Haematology unit. They receive their initial treatment here, but if they require a bone marrow transplant, they would be referred to a consultant within the bone marrow transplant unit at the Children's Hospital. And then they have quite a complicated arrangement where they're needing to attend both units and also potentially the apheresis unit for the collection of stem cells. This will streamline that journey and enable them to really be in contact with the same staff throughout the journey. I think it will simplify things greatly. As well as improvements in individual rooms and accommodation for patients, there's a significant upgrading of the facilities available for relatives and also for patients who are able to spend time out of their rooms to socialise with their families and friends, so that the whole experience for them is less arduous.
So please, we'd really like you to support the above and beyond appeal to make a huge difference to the patients that we look after. We're going to have a new huge combined unit, which means the patients and families, their relatives and all the doctors and the nurses and all the medical team can all work together to really make a difference for patients within the haematology unit.
Nobody's invincible. It can happen to anybody. I was the most athletic, fit person, and you never think it's going to happen to you, but it can just strike down anybody. And it's almost worse for the relations and the people that are close to you. I mean, you get on with it and deal with it, but it's the patient's relatives that I think it's sometimes harder for. And to have beautiful surroundings for them to come into, and just everything to make things look nice and bright, and also for the patient's point of view, some patients deal with it better than others, and everybody needs their spirits lifted, and your donations will make it wonderful, because you never know, it might be you.